This is a Global News special presentation.
Well, Canada now has one confirmed case of the new coronavirus. Health officials here in Alberta say the risk of infection is still very low.
Breaking health news. Alberta has its first presumptive case of COVID-19.
24 hours ago, I was just here studying, and today it's like, wow, everything's canceled.
The world is experiencing the most disruptive public health emergency in over a century.
The steps we take now and in the days ahead will help determine the severity of this outbreak for Alberta.
Together, you've helped to flatten the curve and protect all Albertans.
We're on the brink of a fall that could be much worse than the spring.
COVID is starting to win, and we cannot let that happen.
We need to be able to bend this curve down so our healthcare system is not overwhelmed.
It'll take us all making sacrifices and going that extra mile every day.
I am asking Albertans as clearly and strongly as possible to please be wise and be safe.
9 months of agony, anxiety, despair, but also hope. COVID-19 has changed the world as we know it. Hi, I'm Brianna Carson-Smith with Global News Edmonton. Welcome to COVID-19 in Alberta, a path forward. At the end of a historic year, we want to look back on how we got here and what happens next. We'll hear from survivors, and we'll honor the hundreds of people who have lost their lives to the virus. First, let's take a look at some of the numbers. December 5th marked 9 months since COVID-19 was reported in our province. In that time, we've seen more than 66,000 Albertans test positive. The Calgary zone was the hot spot in the first wave, but in the second, it was the Edmonton zone. COVID-19 has strained our healthcare system. By the 9-month mark, there were nearly 600 patients in hospital, 100 of them in the ICU. Worst of all, nearly 600 Albertans died in 9 months, a number that continues to grow to this day. So how did we get here? Let's take a look.
The first case of the virus in Alberta was announced on March 5th, but months later, retroactive tests determined the first case in our province was actually February 24th.
At this point, it is likely that we will be dealing with the virus worldwide for many months to come.
That bleak prediction came March 9th, with Dr. Dina Hinshaw introducing the phrase, the new normal. To limit that, the first restrictions were issued on March 12th, canceling all gatherings with more than 250 people. 3 days later, schools and daycares weren't just limited, but closed altogether, with the rest of the school year going online.
In order to save lives, I have had to make recommendations that will take away livelihoods for many Albertans over the next several weeks to months.
One day after that admission from Dr. Hinshaw, she announced the first death in Alberta, a man in his 60s from the Edmonton area.
I'm not going to sugarcoat it. You need to know what we're up against.
Premier Jason Kenney addressed Albertans on April 7th, estimating at least 400 deaths and 800,000 infections by the end of summer. But by the end of the month, there was hope. Details of a relaunch were released, and on May 14th, Stage 1 began for most of Alberta.
Honestly, I am incredibly excited to be back at work.
Calgary and Brooks followed a week later because of high caseloads. Stage 2 began 2 weeks later, 100 days after the first case in the province.
The curve is no longer flat in Alberta.
That came from Dr. Dina Hinshaw on July 27th. That Saturday, masks became mandatory in Calgary and Edmonton. Still, most schools opened September 2nd.
I was super excited this morning, so I felt good to be back at school.
In the fall, Alberta was hit hard by a second wave. Cases surged to record highs of over 1,000 daily cases and dozens of deaths, forcing the province to impose additional restrictions on schools, businesses, and homes.
Let's bring in Julia Wong. Julia, you've been covering all of Dr. Dina Hinshaw's news conferences since day one.
Yeah, we've been tracking this virus since the very first reports of it out of China. And obviously, lots has changed since Alberta reported its first case. We now use words like cohorts, distancing, and isolation. Our lives have been turned upside down, particularly when it comes to seniors and students.
The last 9 months have been a roller coaster for Cindy Talbot.
Her grandmother Janet is in a long-term care home in St. Albert, and COVID-19 visitor restrictions have taken a toll.
My grandmother's 100. We don't want her to spend her last years feeling she was abandoned in a home.
Continuing care facilities have been ground zero for the COVID-19 pandemic. The majority of deaths in Alberta have been people in continuing care. Mackenzie Town in Calgary was one of the first homes to see a wide-scale outbreak. 34 residents at Good Samaritan Southgate in Edmonton died because of COVID-19. Class action lawsuits have been filed against both operators. The allegations have not been proven in court.
The damage has unfortunately happened and these families are suffering, but we want to make sure this doesn't happen going forward.
Cindy's father, Ian, is also in long-term care. Her family, like many others, has tried to be creative to stay in touch. She says the province needs to keep these residents top of mind.
What can we be doing better? What can we think outside the box for our seniors to make it safe for them to be within these facilities, as well as be able to have family visits and have that connection piece?
Now is the time for additional action.
Education has also seen its share of ups and downs.
All regularly scheduled classes are cancelled, regardless of class size.
Schools closed to students in March, and remote learning became the norm. In late summer, Dr. Hinshaw signed Order 33. It outlined how students going back to school did not have to socially distance in the classroom. It prompted backlash and a rare one-on-one interview with Hinshaw.
That was the opinions of our policy team in the ministry, was that the order was necessary to be able to provide that legal clarity of the requirement of masking.
Positive cases in schools have been inevitable. There have been outbreaks, forcing hundreds of students and staff at a time to isolate. In mid-September, the first case of likely in-school transmission at an Edmonton school caused some to rethink sending students to in-person instruction.
I'm pulling her out of classes now.
But many students continue to go to classes in a school year that's like nothing we've seen before.
So, Julia, where are we now?
So for seniors, especially those in long-term care, they will be among the first to receive a vaccine. They're considered high priority, considering the majority of deaths have been people living in congregate care. As for students, many had to shift to online learning as the year came to a close, and they're expected to return to the classroom for in-person teaching in early January.
Thanks, Julia. We'll check back with you in just a few minutes.
As always, it is essential that we never forget that these deaths are more than numbers. They are people who were loved and whose absence creates a tremendous hole for family and friends.
Nearly every night, we report on a new death from COVID-19. In 9 months, more than 500 people have died. It's easy to get numb to the numbers, but these are grandmothers, fathers, Albertans. So too are the doctors on the front lines. This is ICU physician Dr. Simon Damares-Marcil making the impossible call to a family, telling them their loved one did not survive the virus. Some Alberta families on the receiving end of those phone calls shared their stories, giving us a glimpse into lives that will never be forgotten.
Me and my siblings keep saying that he was the best dad in the world because he truly was. His boots are still there in the entryway. His toothbrush, his cologne, everything's still there.
Show support for Sean, show support for his wife and his children, and show support for his dream of opening up a center for youth in his hometown of Brewer.
I wanted to make them feel like this was their new home and part of our family, and it was the opposite. He made me feel like we were part of his family.
For a long time before she passed away, she would tell me she didn't want to die alone over and over again.
Trying to come to terms of how she died and why the care wasn't there from the beginning. My dad said to look after Mom after I die, and I guess I didn't do a good job of that for them.
My mother is such a giving person that she would want somebody else to have that bed and that ventilator. If you care about your elders, if you care about your community, if you care about your world, stay home.
To make sure no more lives are lost, researchers are working tirelessly on vaccines. After the break, a look at where that stands, how to manage our mental health, and we hear from survivors. We've heard from the families of victims, but now let's hear from the survivors on what it's like to get COVID-19. Here's Global Calgary's Dallas Flexhawk.
From the moment they got sick to living with the symptoms, I spoke with 4 people of different ages and walks of life who each walked me through what they felt. Here are their stories.
I'm Evan, I'm 19, and I go to the University of Calgary.
Natasha Reynolds, I am 50, and I am the mum of 2 boys.
Carter Stanley, I'm 72 years old.
Kevin Stanley, I'm 42 years old, and I'm a father of 3 kids.
I started feeling a little sick. I didn't think anything of it, and then by the maybe 3rd, 4th day, started getting a pretty brutal fever, super dizzy, super tired.
1 minute I was fine, and literally the next minute, I had this overwhelming fatigue, like a wall of fatigue.
I literally started shaking like a leaf, like I was sitting in a bowl of ice.
It attacked my brain, and I could feel it sending the pain to my back and my hips and down my legs.
I started losing my taste and smell, which lasted about a week, which was really bad. I didn't like it. Just bad.
Every bone in my body hurt. Everything hurt. My skin hurt. My eyes hurt.
Every time I'd fall to sleep, like something in my brain would just wake me up.
Fever's hitting close to 40 degrees. Is tonight going to be the night my lungs are going to give up? It's hell. It really is.
Even if you're super healthy, I've played sports my whole life. I think I got a pretty good immune system, but it's not a joke.
It's so unpredictable. One person can just have the sniffles. The next person on the other extreme ends up in the hospital. And then you have a bunch of us that are in the middle that are just trying to make our way through every day, hoping there's no, long-lasting effects.
For many, symptoms continue several months after getting the virus. These long haulers explain moments of fatigue, brain fog, dizzy spells, and chest pain. Thousands have been sharing their stories in the COVID Long Hauler Support Group Canada on Facebook.
I needed to speak to other COVID survivors like myself who had, hands-on experience. Some people are feeling very isolated, and it's a good place to find the strength and the courage to support one another and be there for one another.
Many say they just want to get back to their day-to-day lives, but the lasting symptoms are preventing that. Dallas Flexhawk, Global News.
After 9 months of struggling through this pandemic, there is hope. Multiple vaccines are sparking excitement and optimism around the world. The Pfizer vaccine had an early rollout in Canada in mid-December. Millions more are expected in early 2021. Each province is responsible for who gets vaccinated first, though it's expected to be high-risk individuals. The average person will have to wait.
If you're someone who doesn't know someone who's had COVID, you may be someone who works from home and everybody around you works from home and your family's relatively healthy and you don't have people living in these high-risk environments, then there's a good chance it's going to be maybe closer to a year for you to be getting a vaccine.
An Ipsos poll for Global News in late November suggests 52% of Canadians are willing to take the vaccine as soon as possible. 62% believe frontline healthcare workers should get it first. The vaccine will prevent physical symptoms, but what about emotional effects? The pandemic has deteriorated our mental health, and that is top of mind for Dr. Hinshaw.
We need to support Albertans' whole health, which means managing the spread of COVID and making sure that the restrictions don't go farther than they need to make sure that we're protecting Albertans' overall health.
Dr. Stephen Taylor quite literally wrote the book on this. He's the author of The Psychology of Pandemics, and he joins me from Vancouver, where he's a professor at UBC. Dr. Taylor, I'm tired. Our viewers are tired. There is a lot of fatigue out there, but we're not alone, right? This is what we see during pandemics.
This is what often happens. The longer these sorts of lockdown situations last, the more fatigued people get, yes.
And it's only going to get worse. January is already a depressing month between Christmas bills. We've got dark and cold weather here in Alberta. It's a bad combo. Add in the pandemic. What would your tips be for that? Are you expecting this to be a difficult season?
It's going to be a more difficult so-called festive season than usual. That said, however, I think it's important for people to be proactive, for plan how they're going to deal with this new Christmas period, to plan what sorts of stress management strategies they could use. For example, what kinds of exercise is going to be feasible wherever you happen to live, given your climate, or what other sorts of things you could do. And we also know from the previous round of lockdown that the very distressed people were engaging in forms of coping that are called emotion-focused coping. And that's coping that's intended to dampen their distress. But that kind of coping can create further problems. And by that I mean things like consuming excessive amounts of drugs or alcohol, or overeating or overspending. So people who've had that kind of problem in the previous round of lockdown, they need to be extra careful this time around.
And you're researching post-traumatic growth. It's a positive thing. So what is that?
Yeah, so it's not all bad. I mean, we know most people are resilient and will get through this despite feeling distressed or anxious or depressed. Now, that's not to downplay the seriousness of COVID-19. It's a serious pandemic. However, some people in our research, as many as 45%, are reporting what are called silver linings or post-traumatic growth. They're saying, yeah, it's been difficult, but there have been some positives. So they're describing things like a greater appreciation for friends and family, a greater appreciation for the little things in life, deepening spirituality, depending on their sorts of spiritual beliefs, and increased stress tolerance. So the hopeful thing is that these people will be able to carry through with those benefits after the pandemic.
There is a path forward. Dr. Stephen Taylor from Vancouver, thank you so much for your time.
Thanks so much.
If you or someone you know is struggling, you can call the 24-hour helpline at 1-877-303-2642. There are also tools and contacts available online at albertahealthservices.ca. The virus has also infected the economy, restrictions forcing businesses to close and reimagine their future. Stay with us. The pandemic has affected every aspect of our lives. As cases surged, the province was forced to implement significant restrictions. Gathering limits were imposed, rec centres and schools closed, sports were cancelled, along with most festivals and events. As the first wave receded, Alberta entered stages 1 and 2 of relaunch, but with the second wave came more restrictions. Hope that we'd see the third and final stage of the relaunch anytime soon disappeared.
We know that if we allow viral spread at current growth rates, we will eventually run out of hospital capacity. That is not an opinion, it is a fact. We are now at a point where we simply must take these, frankly, dramatic measures to reduce general social interaction. It's the only way we can get on top of this. These are decisions that we have arrived at not as a first resort, but as a last resort to protect lives and to preserve our healthcare system.
Let's check back in with Julia Wong. Julia, those restrictions have impacted our social lives, but it's business owners that have felt the impact both personally and professionally.
Yeah, it's been a roller coaster for many businesses, particularly small businesses. The rules and restrictions have been changing constantly as the province responds to case numbers.
Bread deliveries were never on Ricardo Leal's mind. But the COVID-19 pandemic pushed Leal to rethink his business. Sales at his Edmonton bakery plummeted in mid-March, and staff were laid off.
The bakery pretty much went to 5% of the business that it was doing before. All the wholesale, the restaurants that used to deliver to, all closed.
So Leal started a company to deliver bread and baked goods to friends. The idea took off, and the bread truck was born.
It's the bread person, yay!
Leal was able to rehire staff and bring on new employees, and business is good.
Just today we did 80 deliveries this morning, and tomorrow it's probably one of the busiest days we've had since we started.
The pandemic has forced small businesses like Lial's to adapt and pivot to stay afloat.
We just kind of focused on what would people want at this time, and we tried it, it worked, and we jumped on it.
These two, I think.
But it's been easier for some than others. Galleria Inglewood in Calgary shut down after more than 40 years in business. The recession, then the pandemic, and a flood gave owner Susan Copley no choice.
I can't do this anymore. I just can't do it. I've devoted 39 years of my life, and it's just really sad that it's just going to sort of go away.
The province is only in phase 2 of reopening. That means festivals, major sporting events, and live venues like the Starlight Room in Edmonton are indefinitely shuttered.
It's not just financially, it's also been a little bit of a mental anguish for a lot of us in our industry.
As for the bread truck, there are talks about expanding to other parts of the province. A bright spot for this company during these uncertain economic times.
Now, there have been calls to support and shop local so small businesses don't collapse, especially during the holiday season. But it's clear that consumer spending isn't what it was like pre-pandemic.
And Julia, throughout this pandemic, we've seen people across the country forced to work from home. They could benefit come tax time.
Yeah, the federal government is planning a simplified home office deduction that would allow employees working from home due to COVID-19 to claim a tax deduction of up to $400. The Canada Revenue Agency will have more information on that in the near future. And if you qualified for CERB, don't forget that's taxable as well.
Okay, good to know. Thanks, Julia. In what has been one of the worst years, we have seen the best in people, from generous gifts to parade parties. So we want to end on all the good. That's next. In a year when so many jobs, opportunities, and lives have been lost, Albertans continuously prove just how much they're willing to give. That's come in the form of loud salutes to healthcare staff on the front lines. Meals have been dropped off at hospitals and homes, iPads and computers delivered to schools and hospitals to keep us all connected and informed. While we stayed at home, some animals ventured out, including the penguins at West Edmonton Mall. And people in Calgary went on an Easter egg hunt, searching for colorful drawings in their neighbors' windows. The world went silent as concerts and shows were canceled, but music didn't stop as Albertans turned balconies and public parks into stages. Brett Kissel went further. The country star sold out 24 drive-in shows hosted in parking lots in multiple provinces, all for local food banks. Graduations took place in parking lots too. And while so many other events were canceled, love wasn't. Scott and Judy Slade had their wedding plans paused 3 times, eventually eloping at home. 50 years after they were married, Doug and Marnie Sprake were surprised with a celebration for 2. And one man proved no virus, no distancing, no pandemic can get in the way of true love as he stood outside his wife's care center with a sign reading, "Love you, Bernie, I'm still here." A touching love story to end with, and it has been an emotional and exhausting 9 months. There is still a long road ahead, but together we can get through this. Thank you for watching and allowing us into your homes each and every night as we navigate through this pandemic. Here's to a better and brighter new year. Stay safe.